Hey everyone, welcome back to my page. I'm Dr. Sam, and today I'm going to talk about a few different ways to differentiate between erectile dysfunction of organic descent, so essentially something physiologically going on with your body, versus psychological erectile dysfunction. Now, when I think of a few of these causes, there's about five that come to mind that I see in my patients most commonly. And I'm going to go through a few of those, and perhaps you can see if some of these may relate to you. Now, again, I'm not offering you advice on what you essentially should do to treat these problems, but I am here to help and educate so that you know what the next steps are and whether you potentially should escalate it to your doctor that takes care of you or even to a therapist that has more additional information to offer. So here we are. 5 big things that I see in clinic that cause erectile dysfunction. I'll start with the organic causes and then move on to the psychological components. So the first one would probably be type 2 diabetes. Now, remember, insulin resistance occurs long before the diagnosis of diabetes occurs. So what that means is your body's adjusting and not producing insulin as quickly as it normally would in your younger self. Insulin resistance occurs over a prolonged period of time. Once you've been diagnosed with your diabetes, it's at that point where your pancreas has really slowed down. Well, why are we concerned about type 2 diabetes? Well, type 2 diabetes causes problems with nerve function. And if you recall from my last video, nerve function is important for the entire cascade of your erection to even occur. So, taking care of yourself at a young age is so important. If you do have long-term diabetes and do notice that you have peripheral neuropathy or numbness, tingling in your hands or feet, my suggestion would be to advance onto a sexual medicine expert to do a thorough examination of your erectile status. The second big one is sleep apnea. Now, there's not a lot of data to support what I'm about to say, but there are some theories behind this. And the thought is that when you sleep, you go through something called a REM cycle. And during your REM cycle, it's very common that you have about 3 to 5 nocturnal erections at nighttime. And it's really that protective mechanism to give you a strong erection and oxygenate your muscle while you're sleeping so that if you're not having sexual activity during the day, you have something to support that erection. Now, when you have sleep apnea, you are no longer going to go through that REM cycle. So what is sleep apnea? Sleep apnea is essentially that inability to get into that deep, deep sleep, that dream state. And this is what may prevent these nocturnal erections. Now, what are some of these side effects or symptoms of sleep apnea? Well, most men don't even realize that they have it, and even their partners may not realize it either. A lot of people state to me that they don't sleep on their backs. Well, it's suggestive that about 80% of men don't even realize that they turn onto their backs when they sleep and don't even realize that they snore. So my suggestion would be to take a stop bang test. And if you score a 3 or higher on that stop bang test, and you are also noticing that you are having problems with your erections, I would suggest following up with a sleep specialist or even seeing a sexual medicine expert. The third thing is testosterone. So testosterone has been a very heated debate over the last few years. Well, testosterone is one of those really important hormones for a man that helps with endothelial tissue protection. So it helps allow for blood flow to go throughout your body. It keeps your weight down, it keeps your ability to exercise, and it's one of those things that can induce problems, especially with libido or other issues as well. So making sure that you have your testosterone checked in the morning could also be really helpful in identifying some causes of erectile dysfunction. The fourth is a mix of psychological and physiological, and that's SSRIs. Those are serotonin stimulators for someone that has anxiety or depression. Now, this is not me telling you to stop your SSRI, and I would never suggest anyone to stop their SSRI cold turkey or without the authorization of your care provider. That being said, Many people are not educated formally that SSRIs can also induce erectile dysfunction, ejaculatory issues, and libido problems. So, if you are noticing any of these problems and you're taking medications like paroxetine, sertraline, fluoxetine, or anything of that nature, please chat with your doctor who prescribed those medications and see if perhaps there are alternatives that they can offer for you. And again, I cannot express further, do not stop those medications cold turkey without speaking to an expert provider. Lastly, I'm going to turn on to the psychological area, because psychological erectile dysfunction can feel really, really real. And it's really frustrating when somebody comes to a man and says, your erectile dysfunction is all in your head, when in reality, it's something that's actually going on with your body that's really concerning for you. Well, if you recall, I talked about fight or flight in my previous videos, and that parasympathetic response that you get when you are in that fight or flight, whether it's stress from work, stress from not sleeping, stress in your relationship, etc., you can develop a lot of problems within the bedroom. And this is also image issues amongst many other anxiety-related problems. Now, how do you know if something is more psychological? Well, the way you tell is, are you able to get a hard erection in different scenarios? So for example, if you masturbate, are you able to get a good erection versus when you are with your partner? If you can't get an erection with your partner, but you can get an erection when you masturbate, this is likely psychological. But don't stop there, because even men that are so fixated on their erections, they could be watching something that would be super stimulating to them to begin with. But if you are so anxious and focused on your erections, we call that penocentrism, you will have difficulty getting an erection, okay? The next thing is when did it start? That's the next question I ask every person. If you tell me this has been a prolonged period of time where you've been noticing a decline in your erectile function, perhaps the hardness has been worsening year after year after year, then fine. I may say, come in, let's do a thorough medical history and evaluate what may be wrong. But if you tell me that you've had this abrupt change in your erectile status, where last week you had a really good erection, but this week you can't get an erection at all, the first question I'm going to ask you is, what's happening in your life? Tell me what happened in the bedroom, what's causing you stress. And I urge you to think about these things so that you can really talk yourself through it in case you do have a bad episode in the bedroom. And I just said the word bad, and I don't really like that I said that, because at the end of the day, so many men have problems getting an erection inside the bedroom, and it doesn't mean that you have a problem all the time. Life is tough. Life is difficult, and it's okay if if you're not able to perform each and every time you're in the bedroom. So please remember that. And if you are noticing a pattern in this case, and let's say you're of the age of 20, 30, or even 40 years old, I urge you to see a sexual medicine expert and start really low and slow. Maybe try a PD-5 inhibitor like Cialis or Viagra before starting any other intense drugs or jumping to a penile implant. Maybe try some psychotherapy with a sexual medicine expert that can really help you. Maybe discover other things around you that could be really stimulating and communicate to your partner that these are the things you like and this is where you like to be touched. But by no means am I telling you to do anything without consulting someone. So, to wrap up, like I said, there are 5 big things that I notice in men that have erectile dysfunction. Of those 5 things, all would be something that you should speak with a specialist if you are noticing a pattern in these problems. I hope you enjoyed my video. If you have any questions, please feel free to leave a comment below. Otherwise, I'll see you next week.